How important would you say is a vaccine in this fight against COVID-19?
Yeah, Macfarlane, well, for me, I'm thinking of the vaccine as possibly one of the most important public health interventions of the century. Whichever lens you look at it from, it's critical. Firstly, the healthcare of our people. We have people getting very ill and dying, and so we urgently need to deal with that at an individual level. Secondly, from a health economic point of view, the cost of COVID-19 on the healthcare system and on healthcare infrastructure is enormous. And there's a big toll for non-COVID related healthcare, mental health disease, planned elective surgical procedures. So from a healthcare perspective, absolutely. And then, of course, from a macroeconomic perspective as well, we have to get our economy back on track. We want to achieve some GDP growth. And in order to do that, we do need to get this disease under control. So aside from the obvious and massive humanitarian benefits, there's obviously all these economic benefits too.
The Health Minister, Willem Kiese, said that South Africa will be funding the vaccine rollout through government funds. He's called on medical aid schemes to come on board, as well as the private sector. And we've seen a lot of them actually putting their hands up saying that they'd like to play a role. Now, as Discovery, what kind of role will you be playing in this call that has been made by the Health Minister?
I must say that we're absolutely delighted by the solidarity that's unfolding between the public healthcare sector and the private healthcare sector. This is a moment that we're actually all standing together and doing the right thing for the healthcare of our nation at large. In the first instance, the vaccination for COVID-19 has now been made a prescribed minimum benefit. Those are fancy words, but what it means in terms of the Medical Schemes Act is simply that medical schemes are obliged to pay for vaccination at cost from their risk pool of funds or the insurance funds that the medical schemes hold on behalf of members. So that means that all adult members of medical schemes will be covered in full for the funding of the vaccinations. That achieves about a 15% coverage, 7.1 million adults, about 15% of South Africans. In addition to that, it looks like the vaccine will be priced at higher than the cost price for the private sector. And the surplus that will be generated through the medical schemes funding their own members, that surplus will be redirected to fund an additional 7 million people, or another 15% of the population. And so the medical schemes role here effectively is to ultimately end up funding about 30% of the South African adults' costs of the vaccination. Now, this is not an unprecedented situation. In fact, if you look at medicine pricing in general over many years already in South Africa, the private healthcare sector tends to pay higher prices for medicines than the public healthcare sector. And so there are some subsidies that have always existed. So this isn't unprecedented. And in fact, at Discovery, we're delighted to be part of this initiative.
It's great that that we've come this far, and you speak about the fact that this is unprecedented. But there had to be an amendment that needed to be made to an act so that the prescribed minimum benefit could kick in, especially for the vaccine. What has that conversation been like with government? Not only around the issue of funding, but getting an amendment like that, even to an act so that people can get access. How easy has it been to get into those kind of talks with government?
Two answers to that, Macfarlane. The first is to say that it's been a very warm, collaborative, open discussion, very transparent. It's been handled by our Council for Medical Schemes, who've engaged with the industry associations, the Health Funders Association, of which we as Discovery are members, and the Board of Healthcare Funders, which is another association in the industry. And that's been an open, transparent, warm conversation and warmly received by the medical schemes industry. So this has not been a situation of being dragged to the finish line at all. In fact, it is strongly collaborative. The other point to make, which is important for you to note, is when the prescribed minimum benefits were settled in the Medical Schemes Act, they were always intended to be a dynamic set of benefits that would be updated from time to time. And so, in fact, the way that the Act was written was with amendments to the prescribed minimum benefits in mind.
Were you already in direct negotiations with vaccine manufacturers, or was that then left to government? Because you're saying that this process had already started for you as a company.
We've been talking to the vaccine manufacturers for a few months now. We've obviously been trying to stay very close to the manufacturing process, to the clinical trials, and to the emerging evidence and data. Our intention was always to try and secure vaccines, of course, for our members, but hopefully also more broadly. The vaccine manufacturers have made it very clear that they prefer to be dealing with governments in every country. One can completely understand that they're experiencing unprecedented demand on a global basis. And we recognize that a nationally coordinated effort in light of the huge population health benefits is critical in this vaccination program. So the vaccine manufacturers are now negotiating directly with the Minister of Health, who's in regular contact with them and who's trying to secure the procurement of these vaccines for the country now.
Have there been any guidelines or advice that has been given from, private medical aid schemes to government? I mean, when you read some of the literature around the negotiations that are happening between you and government, is that you've put down quite stringent measures to say that there has to be transparency, there has to be a proper rollout plan, and you need to know exactly what it is, what kind of role that you'll be playing. How was that accepted by government, and are those some of the terms that you set aside to say, if we're going to play a role, this is how we want to play a role?
The way you describe it sounds like these were a set of unilateral demands, which isn't the case at all. In fact, this has been a collaborative, warm discussion between the private and the public sector. The Minister of Health, to his credit, appointed a task team to lead the work on the funding of COVID-19 vaccines. This task team is being led by Dr. Adrian Gore, who is also the Group CEO of Discovery, although his work in the task team is in his personal capacity. But importantly, the task team, which includes also Dr. Akwana Tulare, Dr. Anban Pillay, who are preeminent members of the healthcare community and from the Department of Health, it's a task team representing both the private and the public sector. And so really in the task team itself, the solidarity between the healthcare sector is visible in its makeup. And as a result, what's unfolded has been, a totally collaborative, like-minded process.
How much money are we looking at? What is it going to cost to purchase and distribute enough vaccine for South Africa?
It's a tough question, and you would think that's an easy one to answer, but let me explain why not. Firstly, we will take the first vaccine that's available for the country, but ultimately we may land up with a mix of vaccines in our vaccination program as South Africa. The vaccines are all priced differently. They're all priced in different foreign exchange rates, and there's foreign exchange fluctuation. And the final deals haven't yet been concluded and negotiated. So as a result of this mix of vaccines, the discrepancy in prices between the manufacturers, and also the foreign exchange fluctuation and final deal confirmation, we don't yet know exactly what the total package will cost. Professor Glenda Gray and a group of experts published a review in the South African Medical Journal recently. Their estimate was that it would cost the country somewhere between 1.8 billion and 18 billion. Now, that's a very wide-ranging estimate. And so, that kind of describes exactly what I've just explained to you. Our view, looking at it from the medical schemes industry perspective, importantly, is that we've wanted to understand what the potential maximum cost is for the medical schemes industry. That's important for us because we need to be able to price for that and understand that schemes can afford that. Our best estimates are that it would not cost more than 7 billion rand to the medical schemes industry. Now, while that sounds like a lot of money, actually in materiality terms, that's a very small percentage of the total annual gross premium income, or the premiums contributions that medical schemes receive on an annual basis, about 2% of gross annual premium income, and as a result, quite affordable for medical schemes.
Will you in any way be involved in the distribution of the vaccine to average South Africans? If you think about the fact that, 40 million people need to be vaccinated, that's a really, really large job, and it involves clinics, it'll involve pharmacies. What sort of role do you think you're going to be able to play in making sure that, not only your members, but also the general public, which you're subsidizing, does get vaccinated?
The short answer is we don't know yet, but the reassuring part of that answer is that there are extensive conversations, discussions, and thoughts underway. We come off actually a very strong working base as a country. Both the private and public health sector in South Africa are renowned to have very robust vaccination rollout programs. It's a strength of our healthcare system, both in public and in private in South Africa. And we have very good vaccination penetration. Certainly compared to other developing or middle income countries in the world, we stand out in terms of that strength. So we're starting off a strong base, and we will leverage that strong base. That said, it does require detailed logistics and planning. We do need to get vaccines to many tens of millions of people, and that planning is currently underway.
When you speak about that planning, there's been very harsh criticism about government's rollout strategy. Some are going as far as saying that we've missed the boat when it comes to, trying to get vaccines to the people. And now we're at the back of the queue with other countries having planned quite properly. Would you say this outrage is justified, or would you say that it has taken meticulous planning to get to this point?
I think that what we recognize is that this is a very complex set of dynamics. There were a large number of vaccines, in fact, about 200 vaccines that are in clinical manufacture and trial process. Nobody knew which of the vaccines were going to win the race. What the manufacturers demanded up front in order to secure stock early in the process was quite large financial deposits, and also acceptance of a liability to pay for the full stock that was pre-ordered. And so these pre-purchase agreements made it prohibitive for some countries and some governments to enter into early arrangements. All I can say, Macfarlane, is that what I'm seeing now, since we've began these collaborative discussions, is a great deal of urgency, a lot of solidarity between public and private, and a very strong leadership from the minister at the moment to ensure that we can get them in as quickly as possible.
What are we looking at when we speak about as quickly as possible? When will we see the first vaccines arrive in South Africa? Everybody speaks about the second quarter. Are we anywhere near that?
Very important question. Actually, that's the question I wake up asking myself every day. From our point of view, the sooner the better. If it could be tomorrow, that would be fantastic. We are ready to fund this and vaccinate our members. The minister announced that for the first at-risk group, which is a group of about 1.25 million people, his own aspiration was to try and get those in by February 2021. That would be outstanding if we could achieve that. Our expectation is that it would be Q2 2021, so from March, around about that timeline. But the short answer is as quickly as possible, and we're working furiously and tirelessly in the background to achieve that.
Just from your members and what you're seeing and whatever your actuaries are telling you now, can we afford to wait that long? Looking at people getting hospitalized, looking at people, dying, and maybe looking at some of the things that your members are asking for to try and keep themselves safe. Can we afford to wait that long?
Well, every day that goes by, unfortunately, there's sickness and there's loss of life. And the impact of the second wave has been devastating on many families and on many of our members and many South Africans. It's painful as a healthcare provider, as someone deeply involved in the healthcare system, to be inside this process and to be watching this unfold. So, Macfarlane, in short, the humanitarian need for this and the healthcare requirement for this is simply massive. If you look at the benefits of vaccines, you can think of it in two levels. The first at an individual level, where a vaccinated individual will have a much milder disease, much shorter duration of disease, and hopefully would not experience the complicated, severe adverse effects of COVID-19. And if you think about it at a public health level, perhaps the asymptomatic people would not get infected, And of course, at a public health level, if we can achieve herd immunity, it means that we really bring this epidemic to an end, and the economy and normal life can resume. So considering those individual and public benefits, there's an extreme urgency to get this done.
Ryan, I'm just going to then, if I'm a Discovery member, and this is for my own understanding and maybe your members' understanding, is that once the vaccine arrives, how am I going to get it as a member? And will I be first in line?
First in line, the honest and open answer is no. Of course, you can understand that it would be ethically inappropriate for a young, healthy member to receive vaccination before an at-risk person who's carrying high risk of severe manifestations of COVID-19. That would be ethically inappropriate. Of course, I must point out that in the medical schemes industry, there's a very large number of at-risk populations. And those populations will get the vaccine when all the at-risk people receive that vaccine. All countries around the world are taking this approach. There is a prioritization approach that's almost become standard practice, identifying the highest risk people first. These tend to be frontline healthcare workers who are unfortunately exposed to a very high viral load, the elderly in old age homes and care homes, people living with severe chronic illnesses, essential workers who are out there trying to keep our country running and are continuously exposed. So these are the groups that must receive the vaccine first. And whether they're medical aid members or not, we should ensure as a country they receive the vaccine first. From a public health perspective, this makes the most sense because this would reduce the burden of disease fastest, and also addressing the vaccination of the most at risk would mean that the severity of illness that we're seeing should immediately be reduced as a result of the highest risk being immunized first. The other part of your question was, how would I actually receive the vaccine? Aligned to your previous question of the logistics and distribution, we don't know that answer yet. My own personal view, Macfarlane, is that we should be using existing medicine supply chain channels. We have very robust medicine supply chain channels, particularly in the private sector, but also in the vaccine management in the public sector. Leveraging those strong existing supply chain channels makes a world of sense. We have an excellent pharmaceutical retail industry. We have strong controls around highly scheduled drugs, Schedule 5 drugs and above, some of the morphine-related compounds and so on. And if we apply those same controls with a digital tracking and tracing system, the existing medicine supply chain seems robust enough to handle this at scale.
One other thing that has obviously been suggested, especially by the medical aid schemes working with government, is to say that, and you also mentioned this earlier on, that you would be subsidizing those that cannot afford or those within the public health system. How would that work? Does that mean that that there'll be a higher cost for the vaccination, and once my medical aid pays for it, it means now one person in the public health system will now be subsidized to be able to get the vaccine?
Yeah, your description is accurate, and the final details are yet to be ironed out. So it's important that I qualify my description of this by saying that we're waiting for final decisions and finality around this. It does look like the vaccines will be centrally procured, and there are discussions underway to consider who should do that. Perhaps it makes sense for the Solidarity Fund, which is an organization with incredibly robust governance, very powerful integrity, that's extremely well capitalized, and is a special purpose organization to support COVID-19. Perhaps somebody like that could be in a position to centrally procure the drugs. In the case of the medical schemes, then we would then procure the drugs through the appropriate legislative exemptions and support from, for example, the Solidarity Fund. And as I described earlier, if medical schemes pay a higher price for the drug than the landed cost price, this would generate a surplus on the purchase by medical schemes, and this surplus could be redirected to cross-subsidized non-medical scheme members in the public domain.
So the question is, if I'm an ordinary Discovery, a member, and I'm quite healthy, I don't have any comorbidities, I'm pretty healthy. When will I, as your member, when can I expect to get that vaccination?
So the answer starts by saying that as soon as possible. We would want all of our members to get vaccinated tomorrow if that were feasible, so as quickly as possible. The minister has set an aspirational target of achieving 67% coverage of the entire population by the end of 2021. The type of risk group you're talking about is a low-risk, young, healthy group. And so assuming that we can achieve the minister's target, the good news is that it would be during 2021 that we'd be able to achieve the vaccination of some young, healthy adults in South Africa.
This has obviously been a huge, private-public undertaking. And you speak about the importance of this. How critical is it that we get this right, not only in the private sector, but in the public sector?
It's life and death, Macfarlane. It's the health of families and people around us. It's the recovery of our economy that's on the line. It's a humanitarian crisis that we're needing to address. And the best tool that we have in our pocket at the moment is the vaccine. Second to that, we've got to adhere to non-pharmaceutical interventions, which you've heard so much about. Social distancing, specifically good hygiene precautions. We've got to do excellent contact tracing, like supported by the COVID Alert SA app. Those are the only tools that we have in our armory, and the vaccine is the best tool. And so I would say there's nothing more important from a public health perspective.
And Ryan, looking at your numbers and possibly the analytics that your actuaries do when you look at what your members are going through at the moment, it would be interesting to find out how much of an impact this entire, disease has had on your members. When you look at their mental health, when you look at their physical health, when you look at them just trying to survive on a day-to-day basis, what sort of feedback are you getting from doctors and some of your members?
Well, the first thing that I must grab onto from your question is just to speak about the frontline healthcare workers, the doctors, the nurses, and the other hospital staff involved in treating this disease are the absolute heroes here, Macfarlane. They're putting themselves at risk. They're working tirelessly. Many of them are exhausted, and they are delivering outstanding care. And what we've seen from our healthcare system is that our outcomes have been as good, if not better, than many other well-developed healthcare economies around the world. So our healthcare system has outperformed, has done outstandingly well, and it's thanks to those frontline healthcare workers. They are really experiencing the most significant toll. From our members' perspective, we're seeing a very large number of members impacted and affected by this disease, particularly during the second wave. We're seeing a much larger number of infections than we saw during the first wave. As we sit here today, we have about 2,200 members currently admitted to hospital. That's a large number of families. Many of those people are unfortunately needing intensive support. They're oxygen dependent and may well be critically ill. We're also seeing a relatively high mortality rate, unfortunately, across the Discovery Health Medical Scheme base. About 2% of members who are tested and reported to be positive, unfortunately, are demising from this disease. That's about 9 or 10% of those that are admitted to hospital. So this is having a devastating impact on our entire population, including our members.